I'm Chris Thompson, University of San Francisco, nervous in front of large crowds.
Right. Don't believe that. I'm Reid Kruse. I'm from Minneapolis, Minnesota, and I have my own business called HealthSource Solutions.
And our fearless leader.
Hi, I'm Ashley Reid. I'm from Philadelphia, and I'm owner of Active Mom Fitness. So you guys, I'm going to stand up because I was just saying I'm a little short to even see the slides. I first just want to go over what we're going to talk about today. I appreciate you guys being here, and we are going to cover a few categories. One is we want to talk a little bit about program design considerations. So what does that mean when you're planning a health promotion program? What things should you consider? We're also going to look at practical approaches so that you're able to evaluate your programs. And then we also, once you have the people there, how are you going to get the people there? And then once you have them, how are you going to retain them? So we're going to cover a lot. There's so much to talk about with program design, but we're going to give you an overview so that whether you're in programs or not, you'll have at least a structure to get you started or to improve on the programs that you're already doing. You'll see a whole list, which I'm not going to read through every single one, but on the left, everywhere from starting with a needs assessment to the point where you have a program planned out and now you're looking for funding sources. And then on the right, those are the areas that we're going to focus a little bit more on today because they tend to be the overlooked areas. So we'll get into partnerships, cultural modifications, sustainability, and then we'll also give you an overview on evaluation as well as the recruitment and retention as mentioned. So we're going to go ahead and start. We want to give you guys a little bit more specifics, so we have some case studies to go through. We all bring different perspectives to the table, so you're going to hear a little bit from each of us, but I'm going to let Chris start off.
Thanks, Ashley. So our goal today is to give you a little bit of information about programs that each of us have been involved with, and then provide a large amount of time for Q&A. So a hot topic panel. We just want to give you a little grounding as to the experience that we have with health promotion, and then move forward with you guys asking questions. And really what we want you to be doing is thinking about how you can bring health promotion programs into whatever community that you work with. And it's a very interesting and challenging process. We've learned a lot ourselves, and we hope that we can help to illuminate some of the issues that we've been through before. So I'm going to tell you about Always Active. Always Active is a health promotion program that I've been involved with in the city of San Francisco since 2007. And it's been an interesting experience for somebody who's in academics like myself to work with a number of community partners and provide opportunities for our students to get out into the community and get really good service learning experiences. So number one, what is Always Active? It's basically a citywide health promotion program. We're funded through a few different sources, including the San Francisco Department of Aging and Adult Services. So San Francisco, being a progressive, forward-thinking city, decided it would be a really good idea to put forth some prevention funds for older adults to be physically active. And we run this program through a number of senior centers around the city. Additionally, we have some other private foundations as well, including earlier today, Dr. Salas from Kaiser Permanente gave a talk, and Kaiser Permanente's Community Foundation is another one of our funders. Our funding has been through 2007 up until now in 3-year funding cycles, meaning we have been renewed on 3 different occasions, because we've learned a lot from our partnership, and we all bring different strengths to the partnership to allow us to be successful in delivering the program and also proving that we're successful and having evidence to suggest that and keep our funders happy. So you can see some of our partners additionally, and UCSF Medical Center and Kaiser are a couple medical centers that are really involved as well. Program overview, here we've got good old Claire going through a gate ladder associated with our fall prevention program. That's always fun. We do that as an aspect of Always Active. We have one-on-one wellness consultations, so 900 times a year our staff gets together one-on-one for about 15 or 20 minutes with every senior to help figure out what their goals are going forward, whether they're new to the program or they're renewing each year with a new physician consent. We have ongoing general strength and flexibility classes, and we offer over 30 classes per week at 14 different sites around the city. I'm specifically involved in our partnership in developing and offering a fall prevention exercise class, which is more specific to issues of falls. We get a lot of referrals from physical therapists and also orthopedic doctors around San Francisco who are concerned about their patients, and they come into our program, which is essentially a 12-week entry point into becoming and maintaining more physical activity. And another thing that we do is, in order to keep our program sustainable, we do trainings of fitness leaders. We really want to ensure that if our money goes away and we have to go away, we've got community leaders at each site that can continue to offer exercise classes. So we run through a curriculum developed by the American Senior Fitness Association, and I guide them through a training workshop. And we've had a lot of people certified since 2008. So we have a lot of built capability, capacity building within the community. All right, so here's some lessons that we've learned from the old show. Carl Malden and Michael Douglas, I think. Yeah. Run around the streets of San Francisco. Here are all of our different sites. So you can see we're all around the city. This includes a major multicultural component. One of our centers is virtually all monolingual Spanish. 2 of our centers are basically all monolingual Mandarin speakers. So we have to make sure we're recruiting instructors who can speak and communicate effectively with that audience. A couple of things. Number one, with a large community-based program, it's essential to clarify expectations. Each partner needs to be delivering something specific to the program to make it work. And we need to formalize that through subcontracts or MOUs, Memorandum of Understanding. We need to ensure that each organization is pulling their own weight. If somebody starts to drop the ball, the whole program's in jeopardy. So each year we go through a subcontract, we sign on the dotted line to ensure that all the partners are going to continue to do what they want to do or what they're supposed to do. We have monthly partner meetings. Okay, and San Francisco is a crazy town. For me to drive from campus to the south side of town might take 45 minutes. So it's a big commitment for us to meet on a regular basis, but it allows us to represent all of our partners equally and make sure the ball, so to speak, is not being dropped on a regular basis. Additionally, having an academic connection is good. So something that I bring to the table, being associated with the University of San Francisco, includes the fact that we have a number of students. USF students, raise your hands. Okay, so we've got some USF students here. And several of these students have been involved with the Always Active program, either assisting with leading exercise classes at our different sites, acting as student trainers within the fall prevention program, or assisting with our semi-annual fitness assessment. For our funders, we collect a fitness assessment data point twice per year so that we can show the City of San Francisco, Kaiser, and our other funders that all of our participants are either at or exceed the age expected norms for things like muscle strength, cardiorespiratory fitness, agility and dynamic balance, and all sorts of good things. So that helps us maintain our funding because we have evidence to back up the success of our program. Additionally, it's nice to be able to present information about our program at academic conferences and conferences like the Health Fitness Summit so that we can help guide people who may be considering developing something similar in their communities as well. We also got to make sure that we celebrate the good. We have to make sure that the city and people in the city know about us. So we put on a lot of events, fundraising events to help raise money for the different senior centers involved. And we come and we speak and we provide, every so often I have to MC an event, and it's kind of fun, actually. We have a good time with that. And we celebrate our successes, and we've had a lot of them. In fact, this year, we're celebrating our 10th year. We're renting out one of the big theaters in downtown San Francisco, the Herbst Theater, and we're going to have probably about 500 people come, and we've got music, and we've got food, and we're basically having a nice big video, a retrospective of 10 years with Always Active, to celebrate the fact that we're in San Francisco, we're here to stay, we're doing everything we can to serve our seniors. And it's essential for us to come together and celebrate when things go well. There are going to be challenges over the course of trying to put together a large collaborative program. So in addition to dealing with challenges, you want to also have a good time and celebrate when possible. So Valerie, who's our lead agency director at 30th Street Senior Center, She knows the salsa, and we had some fun time salsaing that night. I learned a few new dance moves. We celebrate the good. All right, so I'm going to pass it on now to Ashley, who's going to be talking about the work that she does in the city of brotherly love.
Thank you. So I couldn't decide on just one program. The work that I've done, it all is around preventing chronic disease through nutrition and physical activity. So rather than focusing on just one of the programs, they've all been kind of connected and built off each other. So I've done programs in a predominantly Latino community, and I wanted to just give you a brief overview before I get into the actual program. So the community that I worked in is in North Philadelphia. Anybody from East Coast been to Philly? Yes? Actually live in Philly? All right. So this area is eastern North Philadelphia. It's actually one of, in terms of socioeconomic status, it's one of the poorest congressional districts in the country. So you can imagine some of the challenges that come with that. And most of the residents are living below the federal poverty level. The health conditions, as we know, social determinants of health, a lot of it has to do with education and income. So as you can imagine, there's a lot of poor health starting with the children. The children are disproportionately overweight and obese, as well as the adults. High blood pressure is an issue, and the reporting of diabetes is higher than anywhere else in the city. With that said, the lay of the land, to just kind of give you a picture of the community, there's not a ton of green space. There's a lot of schools, but a lot of the schools, as with the rest of the city, a lot of the schools are struggling. There's few grocery stores, a lot of corner stores. There are community gardens, and there's a lot of good farmers market programs. So that's what we're working with, and those are all the things that we kept in mind as we did our needs assessments with the programs. And as I mentioned, I've done a lot of different programs. They've all ranged from 8 to 12 weeks and involve some sort of nutrition education and physical activity component. Some of them have been done in schools. There was a program, a childhood obesity prevention program that we did over the course of 3 years. So we got a lot of good dosing information on the effect of kids receiving the same program over and over. We've done after-school programs where kids sign up for clubs. One of them happened to be our clubs, and we've done that at different sites. We also did community-based programs. So actually at the community organization that I was working with, we would have people come to us. And most of the time that looked like seniors based on the time of day that we offered it. But then we also kind of took what we learned from the kids programs, the senior programs, put it into a family model, and we had people come in the evenings as a family, so as parents and children coming together. And so I wanted to focus a little bit on the cultural considerations, and this for us was important because we were in a community that was predominantly Latino. However, with any program that you're doing, you're going to want to consider culture. There's a lot of good models of programs out there. There's a lot of good curricula, but it's never a one-size-fits-all. There's the model of what works, but chances are you're going to have to modify it for it to be relevant to the people that you're working with. So for us, it was how do we make it relevant to the community I just described? But you could very well take the same type of program and go back to your own communities and say, well, what's going to work with this community? What factors do we have to consider? So that's one thing that is often overlooked. You choose this program, you say, oh, there's a lot of research and the results are good. This is going to be great for us. You do it and you fail. You wonder why you fail because you haven't necessarily made it personal or relevant to the community that you're working with. So what things did we look at? Some of the elements that I've included here, one is family. We looked at our community as being strong within the Latino community. Family is very important. Often extended family do things together. Oftentimes families were large. So we said, well, how is that going to be a strength for us? And that's where we expanded and included our nutrition and physical activity for families where parents were coming with their children. We used family as a form of social support, which we all are learning is really important with exercise adherence and other programming. But we also had to look at, so how could family be a barrier to our programs? So if we held events at night and we wanted adults to come, what's the likelihood that they're going to be bringing our children? What are we going to do when the children are there? And how can we then have childcare? Do we need childcare, or are the children going to participate? So all of these things, if you're looking at family just as one aspect, can affect your program design. It can affect your budget. It can affect the amount of staff that you're going to need for your program. Secondly, looking at food, I think when you're talking about different cultures, food comes up pretty naturally as a conversation. As a nutrition education program, we're obviously going to be talking about food. What type of modifications are we going to make so that it's culturally relevant? And one thing that we did consider is, okay, well, what food do they have access to? So I've already mentioned that the grocery stores aren't great, or a lot of people just aren't shopping at the grocery stores. So how can we look at the corner stores or the bodegas and say, this is the healthy options here, let's bring that into our education. So as a nutrition educator, you may not be comfortable recommending canned vegetables. You might be all about the fresh vegetables, but if that's not realistic for your community, then you have to modify what your program offers and what you're telling your participants. Also, food is a big part of celebration. So are you going into this saying, you know, I never want you to eat white rice, you have to eat brown rice, yet every single meal, this is what's celebrated. My grandmother has this great recipe with pork and rice. And are you telling this participant they can't have this anymore? So how do you tweak the rest of your nutrition advice so that it's culturally relevant? Language, it seems obvious. If these participants are speaking Spanish, then we just need to translate everything. But what we found, it was a lot more complicated than that. There was often situations where we're working with the family and the children, although they knew Spanish, they weren't comfortable speaking in Spanish. They preferred English, yet the parents maybe only knew Spanish. So how were you going to convey in 60-minute session information in English and Spanish? A lot of times adults would speak Spanish, but maybe they couldn't read or write in Spanish. So is it not enough to just translate the materials? That gets into your evaluations, and if your evaluations are valid, if you're translating into another language. So a lot of things to think about there. Activity preferences was something that we could also use to our advantage. So finding out from the participants, what do they like to do? What did they grow up doing? What's common in their culture? And I wanted to mention that you don't want to make assumptions. So you don't want to say, every person who speaks Spanish loves to salsa. We're just going to have salsa music all the time. It may not be the case. Actually, in our community, it was everybody loved to dance, but we did a needs assessment. We asked what people like to do, so we weren't making the assumptions, but we did find out, okay, in this culture, people love the music, they love to dance. Why not our physical activity be dance? So we're not going to focus on the strength training as much as maybe the cardiovascular exercise with dance. And in terms of behaviors, we want to look at, well, what are your participants bringing to the table? What are they like? How are we going to interact with them? So if I'm coming in and I'm lecturing and everybody's in the audience talking to each other and celebrating what they ate last night and I went for a walk, well, how are we going to make the program more social? So thinking about what are the behaviors, what's the cultural behaviors? Do they like to talk? Do they like to be social? Are they going to bring their friends? So I have a program, I'm thinking 8 people are coming, but every session they say, oh, my friend wants to come. She heard it's so great, just because that's part of the culture. So all of these things are elements that you need to consider when you're designing your programs, and it may be a little bit different than whatever curricula you're using and planning to use. All right, I'm going to bring up Mary.
Thank you, Ashley. Well, my community is work sites. And work sites tend to have a little bit more of a boundary around them than some of the community initiatives that Kruse and Ashley shared with us. And I say that because it's easier to do things like communication. We don't need quite as many venues potentially for that. Doesn't mean that people listen any different, it's just that the communication is. So when I look at this case, what I really want to talk to you about is that sustainability piece, is how do we build programs so that we can sustain them over time? And Kruse talked a little bit about that, as did Ashley. So when I think about a garden, we can put up the garden, we can sow the seeds, we can take care of those seeds, but to really reap the benefits, what do we have to do to keep people maintaining that garden? And you know, eventually, like anything, it's going to die out, and then we have to replant the garden. So how do we get groups and programs especially to think about this? Some of the challenges that I face regularly in a consultant role in a work site is this whole thing that I call flavor of the month. So they head into the program and they want to dive right in. We want to start a weight loss program. We want to have nutrition seminars. We want to have. And they get so excited about the programs, they forget to step back and think about a plan. You have to plan this out. And it means like some people kind of go, well, it's not fun. Planning is hard work. And so a flavor of the month, and we get this all the time. Well, gosh, we just did, we're going to do a quit smoking program for our participants. And then next month, because it's the holidays, we're going to dive right into a weight management program. And whoa, that's right, it's January, so let's get people getting goals and set goals for themselves. And then we're going to head into February, and that's heart month, so let's talk about heart stuff. And it goes on. And I start to shake in the room. So I can't imagine what their employees are doing, because what are they doing? They're vomiting health information all over them all year long. So when we kind of try to get involved, we don't want to crush that enthusiasm, but what we really want to do is to get them to stop and think. And the first thing we ask them to do with their program, and when I'm talking program a little bit different, it's theirs were targeted programs. I'm talking about a year-round initiative for a company as a program. So we ask them, why do you want to do this? Why is this important to you in your work culture? And from there, we get into some goals. And we really like to work towards 2 or 3 year goals with a company, because they might say, well, we want to do this because we want to decrease healthcare costs. Okay, that's great. So if we throw in a couple blood pressure seminars, we do some screenings, we get people moving, okay. But you just said you want to decrease healthcare costs. So what are you going to do? What's the thought behind that? So that's where we get into adding metrics. Then we move down into taking goals, and you can see we have a 3-year plan here, and we have 5 major goals. That's it. You can't solve everything in the beginning. And you'll see that these goals, if I go over here, I probably can read better, because otherwise I'm going to fall off the end of the stage. So look at that. This is fancy. Solid communication plan and notable brand identification. What does that mean? It means that if we're out in our cultures and we don't communicate, employees don't know about this program, that's a problem. So our metric is that employees will recognize the brand programs when they're surveyed. And we do this, and we measure it from year 1, year 2, and year 3. And by year 3, hopefully, people kind of know what's going on. When we say, hey, this is the Healthy Living Program or the Heart and Soul Program, they're like, oh yeah, that's the one where we did blah, blah, blah. Right? So that's so important if you're starting a new program. If you're into your program and you've been doing it 3 to 5 years, now it's the time to freshen it up a bit. So that should be landing in your plan maybe a few years down. That by year 2019, we have to do a facelift on this program, and we really need to think about what are we going to do to make change. So that's the piece of the goals and metrics. And then we dive into a sample strategic plan, which is the bottom left-hand corner. This is an eye chart, so if you can't read that, I'd have your eyes checked. So this is really just sharing with you how we kind of dump it into a written plan and that's kind of our job as a consultant. And then we put it into the simple terms on the right-hand side. Here's an annual plan. And you'll see the way that we do it is on the left-hand side. You can't, again, it's kind of an eye chart, but we have components within our program. So awareness or communication, what are we going to communicate? How are we going to do it? And how are we going to tie these all together? The next one is the programs and events. So we have these programs happening, and what we see that happens in the work site is they just want to keep going. They want to keep going. Let's do another one. Let's do another one. And like anything, people need a break. Okay, so we say no more than 3 programs a year. So if you're going to do a physical activity campaign, no more than 3 a year. But you think, that's not sustainable. You get a move, and then what? So then what we do is we weave in throughout the year with a physical activity program is, okay, let's do some relapse prevention. Let's do a dust off your pedometer or get out your Fitbit program and do it for 5 days, and then we put it away again. Oh, and that's right, we're going to do a seminar coming up this month on financial fitness. So as long as we're going to be talking about finances, let's ask people to get up and move regularly throughout this fitness thing and bring them back to the pack. How many of you are still using your Fitbits? It's a communication, it's an answer. We're trying to build sustainability. How do you keep weaving a message back into what you're doing all year long without having to stop and do another fitness program to get the people back on the fitness wagon? We're trying to keep them on the wagon. So that's one of the challenges that we have when we're looking at sustainability. And if you leave with anything, think about how do we weave this message through all year long. I share a story about the bathroom. Not because it's kind of crude, but so you're doing a hydration program and you're having people drink regularly, right? So I have this guy and he's drinking, and he used to drink, no doubt, 3 64-ounce glasses of Mountain Dew by noon. And I said, wow, that's a lot of Mountain Dew. And he said, yeah. And he goes, so I switched to water thinking that, it would be healthier. And he goes, but I have to pee all the time. I'm like, think of that. Weave that into your message. Increase your consumption of fluids, and you are going to get extra steps in your day. Better yet, if you go to the outhouse in the back 40, even more steps. You can be creative. You can think about this, okay? So when we talk about sustainability and with a company, these are just what we call key performance indicators. Another way to lay it out, everybody takes messaging different. So when you think about key performance indicators, we had 3. We boiled this down. We made it simple. Strategic plan. Why are you doing it? How are you doing it? And what are you doing? Are the leadership expectations aligned with what you're doing? And I can tell you, moreover than not, we head into programs and we say, well, what is it leadership wants out of your health promotion initiative? They go, we're not really sure. That's a problem. You need to ask them. Because you know what? You might thinking it's all about healthcare costs. You might be thinking it's all about the money and the finances. And you have the CEO going, hey, I heard that if we get people up and have them break more frequently during the day and we do walking meetings, people are more productive. Have you heard that before? And you're kind of like, oh, we're over here trying to reduce risk, and he wants to know whether or not we're getting people taking walking meetings. That's a problem. So for sustainability, you need to align your expectations. Same thing then with the individual. How do you boil it down into some really simple things? Engage, support, and maintain. That's how you build in sustainability. We are great. We do good at engagement. We things like seminars, brown bag sessions. We push out newsletters. We have bulletin boards. We have potty postings. We communicate with people. But that's setting the stage. Once we get them into the programs, as these folks were sharing with you, how do you keep them in that program? And what is the maintenance that's going to have to come after the program's done? Chris shared about how you have 10 years of a program. Well, I can pretty much tell you they weren't working off a flavor of the month. They had to really think through the plan, and they had to freshen up, and they had to change it, because 10 years is a long time to have success with a program. Kudos to you. Okay, the last thing I'm going to talk a little bit about is this whole idea of, okay, so we have this big work plan, and we know that we want to make this, and when we talk about sustainable over time, in the world of Minneapolis, we have what's called SHIFT funding, and when they focus on sustainability, they're looking at policies, systems, and environment. That's what they think of as sustainable. What are we doing to make sure we have policies in place to support healthy behaviors? What are we doing to make sure that the environment and the culture supports those healthy behaviors? And this kind of goes back to, so you have the vending machine. You want people to eat fruits and vegetables, except all in the vending machine is Snicker bars and junk. So what do you do for that? So what are you doing to really look at the culture and policies that help impact that culture? Because policy is really what's going to help drive change. What has happened in the last 15 years with tobacco? It's policy that has gotten us over the years to tobacco-free environments, to tobacco-free workplaces, and now companies can implement tobacco programs and have a tobacco-free campus. The rate of smoking in Minnesota since that started went from 38%, we are now at about 12%. That's policy. You can put policies in place around catering. You can say, you know what, the company will pay for fruits and vegetable trays, the company will not pay for brownies and cookies. That's a policy. That's a sustainable thing for time. So think about that side of it as well. I'm going to go to that last column here. Well, actually, no, I'm not, because we're going to be talking about metrics here shortly. I think, should we transition? Do we want to pause and have a little Q&A? No? Okay, let's just pause with this little section and ask, do you have questions for the three of us regarding, we set up the case study here. And you know what we're going to ask? If you could please stand up at the mics, that would be fabulous, because they're videotaping. Or I can repeat it. Go ahead, yell. Stand up.
So it seems like from what you guys are presenting that a lot of the success and future of the success is going to be on implementing programs at the community and organizational and possibly even policy level. But most of us as fitness professionals, we're really only working with people on an intra and interpersonal level. So do you have any recommendations or words of wisdom on how we can bridge that gap or make that shift to access, more people and implement at a higher level?
Great question. So I think some of the key takeaways from this presentation can apply to wherever you're working, whatever facility you're working in, with whatever population you're working with. We're kind of talking about large programs, but you can apply some of this stuff all the way down to working with an individual client, making sure that you're consistent with the branding of whatever your product is, who you are as a trainer, how you differentiate yourself from other trainers, what you're going to offer, ensure they understand that you've got a plan developed for that particular client so that they can look forward and look ahead to what's coming down the pike. And each class or each time you see the person, you don't want to overwhelm them with new stuff. It needs to be somewhat consistent. Evaluation. Make sure you use pre and post assessments or have a baseline and then check up on that every so often. Those are basic tenets that should be followed when you're working either organizationally or individually. Also, I would say for fitness professionals, the opportunity for you to expand your reach and attract a larger client base, a lot of that is based in you going kind of outside of your day-to-day work and working on developing partnerships in the community. It really, really is a good idea for you to get yourself in front of physical therapists in your town, get in front of physicians in your town. You might have to knock down their doors for a while, and you might have to offer a lot of freebies. I'll come in and talk to your patients for free. I'll come in and talk to your physical therapists for free. And kind of provide information to them so they know that you're a good referral resource. So you can use that to your advantage and build partnerships that ultimately will improve your own bottom line.
I think that was very thorough, and I don't want to take up too much more time on that, but I will say that you, as a fitness professional, you're working with people with physical activity, so you're providing workout, but you're also providing health education, and that's what a lot of these programs are, whether it's at a work site. A lot of people want the health education, whether you're doing fall prevention, and you're needing the skills of being able to convey that information. You need to be able to perform or put together a workout for people. So I think that you have the skills, and like Chris mentioned, it's just a matter of making those connections if it's something that you want to pursue as a job and go into a different direction, or applying it within the work that you're doing. I think is completely relevant with the program design, and taking the time to look at cultural factors and taking the time to look at how you're recruiting more people and retaining them. So I think it all applies whether you're staying individual or if you're wanting to branch out. So I think with that, we'll transition a little bit into evaluation, because we keep mentioning it, but we haven't talked about it too much. And so I want you to only take about 30 seconds. I'd like you to think of the programs that we discussed and what you see as the benefits to evaluating those programs. And after you think for a second, I'll have you share those thoughts with your neighbors. All right, so I'd like you now to turn to your neighbor and share the brilliant idea you just came up with.
You won't have to share out loud, so don't be afraid to verbalize to the person next to you. And whether it's our case studies or ways that you could benefit from evaluation with your own clients and your own organizations, chat about those things for a moment. That'll be yours, right? Right, yeah. I'm not gonna- Good. Wheels are turning. Wheels are turning. I like it. Okay, does somebody want to call out just one benefit of program evaluation? Okay, Nicole. Funding. Okay, so Nicole brings up a great point. One reason for us to evaluate could be for us to be able to maintain funding or provide data that will assist us in the maintenance of our programs. That's a very good point. Other ideas about ways that evaluation could be beneficial? Eric? Absolutely. So that can add to motivation for your client population. You can let them know maybe at baseline some of their data might not be the most positive. Perhaps they score relatively low on various assessments that you do compared to age-matched norms, those sorts of things. But then we provide motivation and also evidence that the program is working if we see them making progress over time. That not only shows them that our program is helping them, but that also helps to build their own self-efficacy that, hey, I'm doing better. Oftentimes, we live with ourselves every day. We don't notice changes that occur on a day-to-day basis because we're not that self-aware, I guess. But how often is it where you see somebody after a few months and they say, wow, you look better, or you're moving better? And you can't even conceptualize that because you don't see those differences. Having an evaluation can help to build that evidence of success and build some confidence and self-efficacy within your population as well, which then they only want to continue to consume whatever the product is that you're offering. So that's valuable too. Anything else? Any other ideas? Yes, I don't know your name. Those are my kids. Well, great. What's your name? Okay, Denise. So Denise basically said, through proving the program through evaluation, it provides a model that then could be replicated, of course, taking individual considerations and cultural considerations in mind. We still can come up with a framework of a program that is likely to be successful if adapted correctly. So absolutely, we can use those data to help develop a model program that then can be turnkeyed out to other settings as well. Excellent. So those are some great reasons to do evaluation. And it's exciting, too, when you see successes and you're able to broadcast those successes. It's a really great thing to do. We are, for the fall prevention program associated with Always Active, we're submitting in the next week a journal article to the Physical Therapy Journal, APTA's actual journal. So it's going to be exciting for us if it gets accepted for publication, and we can actually see that our model is now out there and able to be consumed by whomever wants to really read an APTA research journal. Hopefully, a lot of people. Okay, I'm gonna turn it over to Ashley for the 3 T's of evaluation.
So, and I'm going to stand up again because this podium's in my way. So evaluation can be complicated. It can be simple. The fact is you just should have some type of evaluation. So going back to even at an individual level as a personal trainer, having some way to say this is where you've succeeded, this is the progress you've made, to a program at a work site where you have data that HR is now looking at and healthcare costs are coming down. For us at a community level, we were fortunate to actually have a data team, but a lot of times community organizations won't have that. So you really have to find out what works for you, but you should have at least something. So this framework, the 3 T's of evaluation, gives you an idea of what to consider if you've never done evaluation before. So the first thing is your tools. So how are you going to collect this information from people? Is it going to be a survey? Do you have time to interview every participant? Is it some sort of physical assessment? Can somebody just do an observation during your session? What does that look like? How much time is it going to take? What are the resources? What are the costs? So once you've decided that, you actually have to put those things together. And I'll just give one example. We decided to go with surveys in a lot of our programs, but then we had to look at the language barrier and how that was translated. We had to look at if youth were taking it, do we need pictures because of the different reading levels? And how do we stay consistent with how people are interpreting the survey? So a lot of times we would read it aloud as well as having people take the survey. And we also had challenges. What if we have a pre-post and that's the only thing we have, and half the people aren't there on the last session? What do we do with that? So for one program where we knew we were going to have a lot of turnover with the after-school program, we actually evaluated each session. We took 2 questions every session based on the information that they learned that day. So at least during that session, we were able to say, these people learned this, or they felt this way about this. And if we missed them at the end, it didn't ruin all of our data. So that's one suggestion that I have. Technique, covered that a little bit. Another option is to do it over the phone, or are you going to have somebody that's going to come in and help you do it if you're a personal trainer? Again, if you're doing physical assessments, is the person comfortable with that? Are they going to get nervous? Is it going to be reliable information that you're getting? Have you told them ahead of time that you plan to evaluate them? And then the timing, I've mentioned the pre-post, and I've also talked about how you can do that throughout your session. So what makes sense for you? It's going to depend maybe on the length of your program. If you're doing a 12-week program, do you want to get information before that so that you can then make modifications to your program? So if I go a full 12 weeks and think the program is awesome, and I get to the end and people have like a 50% retainment of the information I've provided, what can I do about it for those people? Nothing. So maybe I do a check halfway through and then I make modifications, or I get feedback halfway through so that I can tweak the lessons or the program that I'm giving them. So that's just a real simple framework to give you guys somewhere to start with your programs, but there's tons of information out there to get a little bit more complex, and you have to get into analysis and things like that. But Mary's going to talk a little bit more of how you're actually setting up your objectives and outcomes.
So this was the slide that I tried not to dive into earlier. As we look at our outcomes and our metrics, back to these key performance indicators, which is a common term that we use a lot in the worksite setting, is what are the things that you're going to measure? Why are you measuring it, and how are you going to measure it? So on the left-hand side of this, you can see that we use things, the health assessment, that's a pre-post lifestyle education thing. It could be lost time from work. So if we're working in a safety program, we may want to evaluate not only the extent of the injury, but how much, what length of time were they off of work before they could come back to work. Things like behavior change, that was what Ashley was talking about, pre-post information. And when we look at things that take time, if we want to look at risk reduction, so our goal, for example, when I had my 5-year strategy, is to have a 15% reduction in blood pressure over 5 years. You have to think about, well, how are you going to measure that over time? And if we wanted to say, yeah, we're going to have a 15% reduction in blood pressure in 3 months, how realistic is it? It's probably not going to happen. So you really have to think about what's the time frame and what is it going to take for a participant to get there. The other side of it then is, what is the expectation on the reporting? Is it monthly reports that you have to turn in? We oftentimes have to turn in monthly reports, especially when we're looking at things like utilization data. And we want to know, how are people doing? As Ashley said, if you're going to measure it, you want to know where you're at. It has to be done fairly regularly. Things like KPIs, where we're actually getting up and presenting in front of people, i.e. it might be the safety professionals, the benefits, the HR people. What is the kind of data that we need, and can we give them really good objective data in a quarter period of time? It goes back to, we can share lost time work in a quarter. We can know how long people were off if they got injured on the job. However, it's really hard for us to share how much blood pressure reduction did we have in a quarter, or what did the cholesterol levels come down in a quarter? Because as you know, it takes a lot longer in a lifestyle intervention to make those changes. So that's the reporting side of it. The other piece I went ahead, is I really want to share is to think about who you're reporting to. And this is critical. Who in our world might be a C-suite. We could have a CFO, a CEO, and it could be the HR benefits person. We're not really sure until we get into the process. So I want to share with you the example. I have a CEO, very paternalistic, really cares about his people. He wants to know every morning he comes in and greets Joe and says, hey, Joe, how's your kids doing the next, and then he passes by the water and, and Sally's there and, gosh, Sally, how's it going with that new program that you're in? I heard you're taking Pilates, and then he goes on, yada, yada, yada. Okay, so Joe is a really highly interactive CEO that's very paternalistic. Then we have the CFO of the company. And what are CFOs? Numbers people. They're kind of like engineers. They love numbers, okay? And so numbers people want to see graphs. They love graphs. They love charts. They like to see change because they are diving into numbers. So when we set up to present to a company, that's one of the things I talk to the staff about that I'm going to be eventually reporting to. So I ask the HR person, I ask the benefits person, how does this, what kind of person is this? And here's why. Because if I go into a CEO who's very paternalistic and I throw up charts and I throw up graphs and I say, look at the difference in this pre-post evaluation, look at the difference in this. Because they're a CEO, they'll listen to you and they get it, but they're going to somewhat tune you out. If I go into that CEO and I say, look at our satisfaction rates, look at the participation that we had in this, look at how we kept the attrition rates because we put people together in teams of, and so our attrition levels came down versus individual programming. And then you share the testimonials. You share the stories. Now I can put up the graphs and stuff, and they're like, yeah, okay, that's great. See, now I'm going to go to the CFO, who's the numbers person, right? What do you think they're going to do if I start out by saying, did you realize that Joe lost 50 pounds in the last 2 years? They're going to say, how many pounds, how frequently, and what were they doing, right? They're not going to care about Joe and the fact that he lost 50 pounds. They're going to care, and they want to know the facts about how Joe did that and how quickly could Joe do that. You throw up the charts and things like that to those people. So it's really critical that you know your audience and what they resonate to. And I'm going to bring this down to the individual level. If you don't know your participants, and I'll tell you, we work with it, we'll go in and we'll do a finger stick blood pressure, let me try that again, a finger stick screening, and we go into a group of engineers, and you know what they want to know? How's that little thing work when you stick it in the machine? They could care less about what their numbers are. They want to know how that little machine works, okay? And then we go into it in a whole different group, and they really are concerned, shh, don't tell anybody, have this quiet, make sure there's good privacy here. And then other groups will go into, and the guys are like, Joe, my cholesterol was 350, what was yours? And you're like, oh, okay, so much for HIPAA, who cares? So think about your population and what they need and what they want when you communicate these evaluations, because that's going to make a huge difference to those people.
All right. I don't know if I can be that animated, you guys. Jump out here. So we've gone through evaluation. We've gone through program design considerations, as I mentioned in the beginning. So you have this great program. Now you just need the people to be in it, and you have to keep them there. So each of us have been through the struggle of getting participants, keeping participants. So we're just going to share a little bit of the challenge and then what we've come up with for solutions. So starting with the groups that I've done, depending on the format, there were a lot of challenges in recruiting people. So for instance, when we held sessions at the community-based organization, we're asking people to come from all over the community to this one location for our program. Not an easy thing. We did flyers, we did phone calls, we promoted at other businesses, we asked different staff people and clinics in various locations to help us with recruitment, but it was still a challenge. So what we did find that we had the most success with was going to groups that already existed, because these people were already committed to something or invested in something or had a friend that was also with them in this group, and then said, hey, would you be interested in coming to this group? So it didn't even have to do with physical activity or nutrition. We went to, for example, our organization did domestic violence support groups. So we let those women know we're having this group. These people were attending group every week. We know they were going to be committed participants. There was breastfeeding support groups. Hey, you guys want to learn a little bit more about health and nutrition? Come to this group. So you don't have to start from scratch to get people. Sometimes it's a lot easier to find people that you know are already going to be committed to something, regardless of if it's related to the topic of your group or program or not. The second thing we found was once we had people, we just learned, how did you hear about this? Why are you here? And a lot of times the answer in this particular community was, oh, so-and-so did this, she loves coming, or like I mentioned earlier, people would just start bringing their friends that weren't even in the program. So we decided, well, how can we use this to our advantage? So after somebody went through the program, we said, hey, there's an opportunity. We'll give you training to become a community leader so you can then help us promote this program. And oftentimes there was a lot of seniors that were interested. They weren't working. They loved to be a leader in their community. They loved that people looked up to them, and they were so proud to be able to say, I did this program, you should do it, you should do it. They would come to us and say, I have this perfect person for you. They'd bring them in themselves. So use the people who really loved your program to help recruit for the next session of your program or to encourage people to stay. We then found that the leaders were also really helpful in the sessions, so we had them volunteering. They've already been through it, so we had them help with, say, nutrition snack preparation, or maybe they were collecting the surveys, or maybe they were helping us with childcare. So a lot of times programming, if you don't have the funding for all these staff positions, you can also utilize past participants to help out.
With our worksite champions, it's doing very much the same thing that Ashley's talking about, is finding those people within your work groups that are interested in helping spread the word. And we look at people that are willing to kind of get out there and shake the bushes for us, because one person or even your communication is only so good. And the power of verbal networking is amazing. And so when we look at worksite champions to reach out into, and again, worksites are communities with boundaries. But we may work with worksites. We have one company we work with that has 72 locations, and so that's a lot of people to try to reach. They have about 6,000 employees at 72 different locations. They're truck drivers, so they're remote. They come in and they leave. And we took engagement from about a 6% level of engagement in a year by building champion networks to share with their colleagues, share with their coworkers about the program, the Healthy Living program, and the response rate was phenomenal. We took it from about a 7% rate up to about 42% in the first year that people knew about the program and were starting to interact with it. And that was just by recruiting site champions. And in the recruitment process, there's no magic. I mean, the things that Ashley shared are very similar, but what we're very cautious about is that we try to get people at all levels of the organization. So you have the frontline people doing things. I kind of say we go this way and we go this way. So up and down. We want senior leaders to be a part of helping promote a program. The site champions, we actually have site champions that are management level people. We have site champions that are frontline staff, and they're all as equally valuable to your program. So in my humble opinion, I would take less managers and more frontline people because they can connect better with their colleagues. I heard said earlier, you don't necessarily want the people that are health fanatics as your health champions, because people get turned off by that. You know, oh, to be healthy, that means I have to be able to run a marathon. So we really try to focus on people that are the average people, or the people that have begun to make change. You know, people can see that over the year somebody lost 30 or 35 pounds and they make fabulous champions. So look for those people that have really tried to make a personal change.
And the last thing that I'll talk about with respect to recruitment and retention has to do with how to figure out who to partner with. So again, bringing it back to the question we had from, what's your name? Jesse. So Jesse, you were asking, how can we take some of this information and then apply it perhaps to your individual personal training business, okay? So the thought is, how can you start building networks within the community for people who will refer their patients, their coworkers, their family members to you? And I would say, start small. The experience I had, I moved to San Francisco from Lawrence, Kansas, little college town. I was involved with basically a big community program in Lawrence, Kansas that had been running for many years. I got to San Francisco and I knew absolutely nobody, right? And I knew that I could not immediately jump in and try to start a community-wide program. It just wasn't going to work. I didn't know the people that I needed to connect with. I didn't know the senior service agencies. So I took a whole year to go out and give in-service presentations at basically every medical center's physical therapy clinic, talk to other physical therapy private clinics, started to meet with directors of senior centers, start to meet with directors of community centers. And slowly but surely, I started to build up a network of people, and I got introduced to people that I didn't know to start with. And it turned out that after a year, I knew kind of the key people within the community that already were doing health promotion programs, went to them and said, you know what, I can hopefully help you out, and we can make the programs that you offer better and more effective by bringing evaluation in, by bringing students in to expand the reach. So, but it takes a long time. So if you're feeling a little bit overwhelmed as to, well, how do I get people to know about me? And man, I've got to go and visit all these doctors now and these physical therapy offices. Just start with one. Just start with one and work from there. Learn what works well, what doesn't work well when you're communicating with those different professionals. Know how you need to position yourself most effectively so that you can develop a relationship that's a referral relationship. And then just take a lot of notes and make sure that you do it better the next time around. And before you know it, you're building a network in the community. So start small. Don't feel overwhelmed. It is overwhelming. It was overwhelming to move to San Francisco for me. It was kind of scary. But, you know, we're still going after 10 years with this program because we started small and worked slowly toward a goal. All right, we're going to wrap it up. I'll give it back to our fearless leader, Ashley, and then we'll take a few questions because we still have 1 minute.
All right, in 1 minute, I will talk really fast, and actually I won't even read all these out to you. Well, maybe I will. All right, so just wanted to recap what we've done. We've looked through program design considerations with, I think we've did a special focus on cultural considerations as well as partnerships and sustainability, which we feel like are some of the overlooked considerations. And we looked at some practical approaches to evaluation, whether you're at community level, small groups, individual training, and then we went through some of our experiences with recruitment and retention. So no pressure, but I want you to think about if this information was helpful for you today. And I'm asking you this because it's, as we've talked about, it's important to get feedback on anything that you're giving. So show me a thumbs up or thumbs down whether this was helpful for you today. All right, great, thank you. So I'm going to move it to our contact info if you want to contact us about anything. And I know we're going to be over on time, but I'm sure we'll hang around for some questions.
Thanks, everyone. Thanks for coming.